right under that. And this question is, I feel like I sleep all the time and I still don't get enough sleep. This has come on the older I get. So what's the balance? How much sleep should you be getting in various decades of your life?
Well, the data is the same whether you're 20 or you're 80. We probably need close to 8 hours of sleep. Now, there are individual variations, but they've done studies across all the age groups. And clearly, they've looked at medical students, you know, and that didn't get the right amount of sleep, etc. There's cognitive decline if you don't get good sleep. Having said that, there's almost no medication that's safe for sleep in older adults. And in fact, I shouldn't say almost, there are no medications that are safe. If I'm taking the geriatric boards, if you're taking the geriatric boards and you check a medicine, you're going to flunk that question. The best way to help sleep is through a technique called cognitive behavioral therapy. I'm going to ask Dr. John at the end to could you describe cognitive behavioral therapy? Because this is the best treatment we have for sleep right now.
So cognitive behavioral therapy is a manualized psychotherapy treatment where you go through various steps at very predetermined intervals. And so for sleep, they have a unique cognitive behavioral therapy for insomnia, where they look at your sleep regimen, and a lot of us think that we have great sleep hygiene, but that's not true. We do a lot of things which we think are innocuous, and so I would say innocent, but it's like even a cup of coffee at 3 p.m. or watching television, or even access to digital smartphones and all during the time we sleep. All this interrupt our sleep. So by addressing our belief systems, which may be probably irrational about sleep, and then taking us through a very predetermined step of understanding what sleep hygiene is all about, we are able to achieve much better results regarding the sleep than utilizing medications, which eventually may be bad for our cognition.
And UT Physicians offers cognitive behavioral therapy groups for sleep. And so those have been very effective. Now, the person who says, I sleep a long time, but I don't feel very well, how many of you have heard of sleep apnea? It's a disorder, right, where you can't get enough oxygen into your brain, you stop breathing during the night. It's become clear in the last 10 years that sleep apnea is a risk factor for dementia. Yeah, in both men and women. And in fact, it can cause Alzheimer's disease. So when I was first in training, we weren't screening for that when we were looking at cases of dementia, but now we do screen for that. And it's a really important risk factor. Do you realize that sleep apnea is more common in this country than diabetes?
Huh.
Yeah, and so it can be treated with those masks, it can be treated with surgery, but I think somebody who's sleeping all the time and doesn't feel like they get good rest, they really should talk to their physician about sleep apnea.
Great. Why do all memory supplements seem to come from sea life, like jellyfish and sharks and salmon? And another question similar to that has to do with supplements, actually, regarding vitamin D. Does this impact the brain? We know that vitamin D is something we can't produce ourselves, and it comes from the sun, and it impacts our calcium. But does it have an impact on the brain?
Okay, so first question. I think that they must think that the electrical stimuli can be transmitted with this sea life and I just don't have any idea. None of these are proven. There's not good data on them. These medications are natural and they're not FDA regulated, so probably I wouldn't recommend it. I've had patients who've had some side effects with them, and so that's my personal view on it. But in terms of vitamin supplementation, it's pretty clear that vitamin B12, I'll start with that, deficiency can cause cognitive impairment. That's reversible.
I'm sorry, let me make you say that again because of my hearing
Vitamin B-
deficiency or efficiency in uptake?
No, deficiency, not enough vitamin B12 in your bloodstream can lead to you not having good memory. When you think, if vitamin B12 deficiency progresses, it affects the nerves in the legs, it affects the nerves in the hands, and you can have a neuropathy with it. But it affects memory much sooner than it ever affects the nerves. And so for low vitamin B12 levels, you should take supplements. Now, people are taking so many supplements that we're now seeing hypervitaminosis B12, and that also can cause cognitive impairment. So in this case, if a little is good, more is better is not true. Getting the right amount of B12 is helpful. We also used to think we only could give it by shots. You may have heard that you can't take the pills, but now with the dosing that we have, you can take oral medications and supplement it. Vitamin D is deficiency. It's not clear how that might affect cognition. We know that it helps your bones. We know that it can maybe help prevent cancer. We think it can help prevent falls. And so having normal vitamin D levels are important, and it might be helpful. It's generally an innocuous medication, except, again, just like vitamin B12, too much vitamin D can lead to fractures. And so we were giving people 50,000 units and, every day for weeks and weeks, and we noted that people started to have more fractures with it. So you need just the right amount. But fortunately, both vitamin B12 and vitamin D can be measured with a simple blood test. So you can get good, accurate levels right where they need to be.
Very good. Thank you. I think we have time for about 2 or 3 more questions, so I'm going to try and get to them. We had a revisit question on general anesthesia. Which types of the classification of anesthesia general affect us the most cognitively? And I would like you to talk a little bit more. So if someone has if someone's gone in for a quadruple bypass, unavoidable, must have general, it's going to be a 2 to 4 hour surgery or sometimes longer. Are you talking about a permanent change in the brain? Or are you talking about a temporary cognitive decline? And then the first part of the question was in regard to what types of general anesthesias are the ones that you really need to pay attention to.
So, well, the first part of the question, as far as I understand, and anything general anesthesia, if they put a tube down your throat and they breathe for you and they give you these gases, then that's a risk factor for cognitive change. So, when I was first in training, we were always taught that cognitive changes after surgery were reversible. Don't worry, it's going to get better. There's no problem. That was the absolute answer that you'd put on the test, and that's what we told patients. But as I was in practice longer, I would see people after surgery, and I couldn't figure out what the diagnosis was because I was always taught that surgery doesn't cause permanent problems. It doesn't even quite look like dementia. It looks more like delirium, where they're very agitated and they don't think as well, and they are very confused as opposed to being a bit forgetful. And so the studies have shown that up to 20% of people after general anesthesia can develop permanent memory loss, permanent cognitive problems. And so it's a serious concern. I know that anesthesiologists are working with different agents to see how it can, how they might avoid that. And again, if you need heart bypass, your heart not working and getting blood to your brain is more serious and a higher risk than the anesthesia. But if you're in a situation where a different type of anesthesia can be used locally, or what we call regional anesthesia, you should talk to the anesthesiologist about that and opt for that.
Thank you very much. This has to do, on one of the last 2 questions, has to do with, I don't want to say medication over prescription, but myriad numbers of specialists who are each prescribing their 3 to 5 medications for the same patient. However, these specialists may not be necessarily communicating with others. And then some of these medications this patient is on have been prescribed for 15 years and nobody's really doing lab values. Can you talk a bit about just
Right.
having a conductor that conducts all of our specialists and our meds?
Well, first of all, there are medicines that, when we're younger, don't affect the brain in the same way. And as we age, they are going to affect the brain. And so what happens as we age is that there is a little shield called the blood-brain barrier. And normally it protects our brain from the effects of medicines we take internally. But as we age, that blood-brain barrier becomes more permeable. Now you add dementia on top of that, and there's even more permeability. And so people are more susceptible to the medication effects, the cognitive effects of medications. And so in the geriatric world, what we do, we ask our patients when they come to see us, say, if it's all right, could you please, if anyone wants to start a new medicine or change your medicine, could you run it by us first? Because there's got to be one person on your medical team that's looking at the whole picture. Somebody that says this interacts with that. If you take this, it'll take care of 2 things. It's pretty clear that once we're on 8 medications or more, that's including supplements, and aspirin, whatever, that there are 2 of those drugs at least are having a fight in your body. There's a drug-drug interaction. And so I think I would look to my primary care physician to say, can all the medicines be run through you? And that way, I think you can ensure that there's some level of oversight. And generally what we do is if we disagree, we simply call the physician and have a discussion, and we put parameters around it, or they say, oh, that's okay, if you prefer to use this, it's fine. So it can be done very cordially, and I think it's the right thing for you, you know.
And this is the last question. Basically, it speaks to, I didn't even know there were such things as geriatric specialists. How old do I have to be able to be accepted into a geriatrician's practice?
Yes.
Sounds like the one advantage of getting older is.
No, so I always used to like to say that, you had to be older than me. But my trainees lately have said, Dr. Dyer, you're going to have to stop saying that one of these days. And that day is just about coming. It's pretty clear that at age 75, the physiology changes. And so that's when it's time to get a doctor who understands your particular physiology. I mean, if somebody's 72 and a half and they want to be, we're not going to turn people away, and healthy aging starts early anyway. But by about age 75, even though you might be, functioning very well, you're using more and more of your natural reserves. And so if you're in a hospital situation or a stressful situation with pneumonia, you may tap your reserves, and in this case, a medication can throw you over the top and cause serious problems. Or the illness, you might suffer more from the illness, or you're operating very well because you exercise so well. You go into the hospital for something and you have to stay there 5 or 6 days. You'll rapidly lose muscle mass. You become more malnourished in the hospital, so, then more prone to falls. So it's at that time we would love if there was a geriatrician for everybody who, after age 75, so these things, whether you're in a stressful situation or you're just thinking about preventative health, could have the age-appropriate care that you need. I can tell you right now, if you Google board-certified geriatricians in Houston, about 35 people. That's it. That's why at UTHealth and the Consortium on Aging, we are hell-bent on recruiting as many geriatricians and palliative care specialists as we can so that they can be there and available for you and I at the bedside when we need them. Listen, none of us, and I know some of you have heard me say this before, but none of us would send our child or a grandchild to a physician or a nurse practitioner who was not trained in pediatric medicine. I think the boomers are going to demand it, but I think all patients deserve doctors trained to give them the appropriate care. And at UTHealth, that's one of our major missions in the Consortium on Aging. Thank you all for being here. I can't remember some of your names.
Dr. Dyer, thank you for reminding us that to err is human, and to forget why I'm standing here is just as human. And especially that the brain can be strengthened and made as flexible as the muscles and limbs that hold us up. And I'd also love to thank Dr. Vineeth John for his diligent responses to online questions that we couldn't get to this evening, and certainly deep gratitude goes to our generous hosts at Mercedes-Benz of West Houston and the Sewell family who own Sewell Automotives. ABC 13 for giving us this incredible platform to inform and inspire the Houston community to lead healthier lives by providing us with greater knowledge through these events. And I'd love to extend our gratitude to UT Physicians, our partners in, I was going to say partners in crime, but our partners in health from McGovern Medical School at UTHealth, who teach, train, treat, and take care of our entire families. If you want more information on UT Physicians, just go to utphysicians.com. Tonight was the second UT Health House Call for 2019, and our next UT Health House Call will be July 11th at 6:30 p.m. on ABC 13, with the other end of the life cycle with pediatrician Dr. LaTanya Love, to help kids and parents and some of us grandparents have a smooth transition from the summer to back to school for the kids. To view tonight's program, please visit abc13.com. Thank you all, and again, thank you, Mercedes-Benz dealers of Greater Houston and West Houston. Hope to see you at another UT Health event very soon. Thank you. And live audience, don't go anywhere.